So when you actually, create a custom plan of care and you actually believe, right? Because there's that word again, you actually believe that that plan of care is going to get the patient better as long as they follow what you say. Now we have congruency, right? It's really hard to sell a product that you don't actually think is going to work. I'm going to repeat that again, right? So it is really hard to sell a product that you don't actually think is going to work. So if you think the patient needs 16 and you're selling them a 6 because that's what you think they can afford, there's some incongruency there. And you're going to be hesitant with that because and you just put a heck lot of pressure on yourself to get that patient better in 6 visits so they can buy another plan of care. Which, by the way, when a patient gets better in 6 visits or less, and you're like, oh my gosh, now I could sell them in a new plan because I got them better, they're going to be like, I don't need to come in anymore. And I always say that on some of our coaching calls, and they all laugh because they all have a patient that's like, I'm better now, I don't need to come in. And they're like, no, like we got rid of your pain, but now we got to fix the root cause of your problem. They're like, bro, I don't know what you're talking about, but I feel great. And you're like, well, I know you feel good because I got you out of pain, but now we actually have a lot of weakness and stuff. And if there's anybody on this call who ever had an injury and I came and evaluated you, I guarantee I could find your weak spot because the body doesn't heal properly. I know that. There's scar tissue, there's inefficiencies, there's weak muscles, whatever that looks like. And I know I can come over there and muscle test you. I'm going to find those weaknesses. So I'm going to find those imbalances. So the body doesn't heal properly. It heals incorrectly. So now we got to get into phase 2. Okay, so now when I sit down and I figure out hey, what are the benefits to this thing? And we just learned in the previous video about custom packages and kind of how they work and, how we're able to leverage custom packages in order to, create a nice plan of care to figure out what exactly the patient needs to get better. So I always kind of sit down and I create this little triangle here, and and there's no specific order because neither one, weighs more than the other. But, I always kind of look at this thing and it's like, how is this going to affect the patients? How is this going to affect our staff? I was going to put providers, but staff. And then how is this going to affect the company? And whenever I kind of make decisions and stuff like that, I always kind of look at this thing like, does it benefit the patients? Does it benefit the staff? And does it benefit the company? And some of the best decisions that we've made in our company, or not just our physical therapy companies, but any company I've been a part of, is that you always want to know, does it affect, how is this going to affect our clients? How is this going to affect our staff? And then how is this going to affect the company? And if they're not all aligned, it's probably not a good decision. But this is one thing that hits all three. And this is why I want to cover this. So first and foremost, a lot of times when patients come in and we just sell them a smaller package, like a smaller plan of care, most patients are smart and they've been to physical therapy before, or chiro or whatever, and they know how long these things are supposed to take, right? Some of these guys are frequent flyers. So when we come in as therapists and we're telling people it's only going to take 2 sessions or 6 sessions to get better, they're a little skeptical. And a lot of times these custom packages, when you lay it out for them, they go from emotional, right? Because a lot of people, when they're buying something, people are very emotional buyers. So we're not getting them to we're not, convincing them to buy for your reasons. You're using more persuasion and influence. So what that means is you're giving them enough details to make a decisions. And they could buy or they don't buy. If a patient buys, right, our life isn't going to be all that much different than if they don't buy. However, if a patient buys and you give them enough information to make that decision, their life could be significantly different, right? Or their experience could be significantly different. So you either make the sale and they come work for you, an amazing company, or you don't make the sale and they go somewhere else. That's what we're up against. So skeptical. Some patients are a little skeptical. They don't actually believe that it's going to work, right? So one of the hidden benefits of creating a custom plan of care is you get someone to go from a skeptic to a believer, right? And a believer is one step away from a raving fan. So just know that those believers, they're like, well, hey, this is logical. This makes sense, right? Okay, there's 4 levels and I'm at level 1. Okay, I got some work to do. The other thing that came up, which is kind of crazy, is we had a couple patients now thank the providers, especially on the women's health and pelvic floor and those kind of niches. And then also just our true cash guys that do orthopedic sports. They actually thank the therapist for actually recommending more than just a 6-visit or 10-visit package. They literally just we had one therapist or one of our clients actually tell us that the patient was in tears because she's went to 2 other providers and they said, well, hey, what I want to do is I want to evaluate you. They did the evaluation. She's like, well, great. How many times do you want me to come in? And she's like, oh, you really just don't need to come in, let's just do once a month for the next 6 months. And she booked her out for 6 visits for the next 6 months. And she said she just did that eval last week. And she's like, I got to get this thing handled now. I can't wait 6 months. And I don't even think 6 sessions over 6 months is going to get, like, how can that actually get me better? So patients are thankful when you guys are scheduling them more often, right? Think about how crazy that is. Patients are thanking us, right? The level of trust goes up, and patients are, I mentioned the word believer, but when a PT shows up or a provider shows up with confidence, in confidence, if you break down the root word, right, just means confide, right? It just means confide. And all confide means is just to trust, right? So if someone has confidence, it means that they just have trust, either trust in the person or trust in themselves. So because we know that, it's just like we're trying to build a layer of trust here, and then we come off as more of an authority figure, right? So honestly, guys, patients just don't believe that they're going to be able to get better. And then not only that, guys, it actually saves patients money in their long haul, custom plan of cares, because now all of a sudden they come in, they bought a 16 pack or a 12 pack or whatever you felt they needed to get better, and then they got better in the timeline that you mentioned, right? Because you're good and you're going to make sure you hit the goals and all this other stuff, and you trust your diagnostic skills. So now they don't have to get injections. Now they don't have to get surgery. Now they don't have to get a second opinion. Now they don't have to get more medication. Now they don't have to have more time off work or whatever. There's all, like, I could keep going and going and going, right? They don't have to get imaging, right? They don't have to go and get like some green drink to try, I don't know. So anyways, there's a lot of remedies out there. They don't have to spend money on that. So they're going to be able to save money in the long run, right? So get them in, get them the results. That's what they're paying for. Okay. The other thing is here, when it comes to the providers here, so our staff, our staff is coming in more as an authority figure, right? Because what happens with those individual plan of cares, we always ask the patient, well, which one would you like to do? Would you like to do the 6, the 10? What the heck do you mean? What would I? It's like a surgeon. A surgeon comes in, they're like, well, you got to get open heart surgery. And there's a lot of valves in there. 4 of them are blocked. 5 of them are okay. I don't know. I'm making it right? 4 of them are blocked. 5 of them are okay. So we could actually do surgery on 1. We could actually do surgery on 2. We could do surgery on 3, or we could do surgery on 4. Which one would you like to do? It's like, what do you mean? Which one would I like to do? Right? What are you asking me for? Right? So think about the credibility and authority from the doctor versus they came in and they said, hey, you have occlusion in 4 of your arteries in your heart. One of them has 80% blockage. We need to operate. We need to operate fast. Okay. So I just want to let you know, what are you doing Monday? Great. Well, guess what? Friday, you're coming in for surgery. Monday, you're in recovery. That's how serious it is. Okay. It's like, oh, dang. Okay. Like I thought I was just coming to get it checked out. I didn't know it was like that serious. Like, how bad is this? Right? It's like your heart's going to explode in your chest, right? You got to come in versus like, hey, we got a couple blocks. You could get it done. Like you could wait a little bit. Like if you want to wait a little bit, that's fine. Right? It's not that big a deal. 80% occlusion. Like who knows? Could be here Tuesday. Could be, I don't know. You could wait if you want to wait. We'll see. It's crazy. Like skeptical. Makes people very skeptical, right? Also, just understand providers are mentioning that they have more congruency with selling. So when you actually, create a custom plan of care and you actually believe, right? Because there's that word again. You actually believe that plan of care is going to get the patient better as long as they follow what you say. Now we have congruency, right? It's really hard to sell a product that you don't actually think is going to work. I'm going to repeat that again, right? So it is really hard to sell a product that you don't actually think is going to work. So if you think the patient needs 16 and you're selling them a 6 because that's what you think they can afford, there's some incongruency there. And you're going to be hesitant with that because and you just put a heck lot of pressure on yourself to get that patient better in 6 visits so they could buy another plan of care. Which, by the way, when a patient gets better in 6 visits or less, and you're like, oh my gosh, now I could sell them in a new plan because I got them better, they're going to be like, I don't need to come in anymore. And I always say that on some of our coaching calls, and they all laugh because they all have a patient that's like, I'm better now. I don't need to come in. They're like, no, like we got rid of your pain, but now we got to fix the root cause of your problem. They're like, bro, I don't know what you're talking about, but I feel great. And you're like, well, I know you feel good because I got you out of pain, but now we actually have a lot of weakness and stuff. Like, and if there's anybody on this call who ever had an injury and I came and evaluated you, I guarantee I could find your weak spot because the body doesn't heal properly. I know that. There's scar tissue, there's inefficiencies, there's weak muscles, whatever that looks like. And I know I can come over there and muscle test you. I'm going to find those weaknesses. So I'm going to find those imbalances. So the body doesn't heal properly. It heals incorrectly. So now we got to get into phase 2. But if you sell someone a 6-visit plan of care, well, guess what? Now they're going to be like, I feel good. I don't have that pain pleasure gap, right? Their pain pleasure gap has closed. Now they don't see the value coming in. Okay. So the other other thing that it helps with providers is that it actually creates those with the custom plan of cares. It takes a lot of pressure off the providers. Now, I didn't realize this, but we had one of our owners, we were going around on one of our coaching calls and he was sharing some of his wins. And he said, you know what's really cool about the custom plan of cares? He goes, it takes a lot of pressure off me as the owner. It takes a lot of pressure off me because I don't have to sit here and worry about getting the patient better in 6 visits just to sell them another plan of care. Now, Joey, who's, Joey's part of the program and my business partner, Joey always says, why would you want to have a hard conversation twice, right? So the first time when you sell them the first package and then the second time when you sell them the second package, just sell them one big package and do it and get it over with. So really, really powerful stuff there. So a lot of less pressure. So a lot of owners are saying, hey, it's less pressure. I feel more congruent. I have better confidence when selling. It's easier. The other thing that I want you guys to be aware of is when a patient comes in and you sell them 16 sessions and they pay one time, right? Versus if they came in and they had 16 sessions and paid 16 times, right? So the psychology here is every time they swipe that card, regardless of price, is they made 16 transactions versus just one big transaction. So research has shown that a lot of people would rather pay up front, right? And then come in for their visits or their service or whatever versus having it spread out each time. They said this is more stressful than this, right? So think of any time that you might have paid in front and then had the visits afterwards. It almost felt like the visits were free even though you paid up front. It's weird how our mind works like that, right? The other thing I want you guys to understand is that from a company standpoint, well, now we're not getting close to that CPV, right? So we're staying away from that. We're able to make money, right? The other thing that we need to talk about is you can actually attract better clients, right? Premium clients. Because now, if you think about it, our pricing is going to repel individuals that want things for free or discounted, right? We're still going to give a discount, but people want things for free or cheap, right? So those people value their money more than your time, okay? Versus individuals who are willing to pay for the result, right? So pay for the result that you just mapped out for them. They're basically raising their hand and being like, I trust you. I believe in you. I believe this process is going to work. I believe I can actually do what you just mapped out for me and I'm willing to pay for it, right? So now all of a sudden we're attracting better clients into our office. And now guess what? Those better clients know other clients. So those better patients know other patients. Premium people hang out with premium people. It's a fact, right? So it's one of those things that now all of a sudden we're going to have a change. And this is the cool part because we start to hear this, that the environment's up, the energy's up, all this other stuff in the clinic. Okay. So those are kind of some of the hidden benefits. The other thing that you understand here, guys, is it's going to be easier to fill the schedule. Okay. So it's going to be easier to fill the schedule. One of the 8 P's that we have is once they commit to the plan of care, we book out their appointments, right? So get all their appointments filled out. So now, if you guys remember in our previous video, we talked about, we want to, filling the schedule. Like when we're looking at our equations here, it's like price, right? So our revenue per visit in volume, right? That's top line. And then we got fill your practice and then expenses down here. So if you guys want to be profitable, it's like fill your clinic, raise your prices, and then reduce your expenses. And that is how you're profitable, right? Just basic math 101. So those are some of the hidden benefits, guys. So hopefully I gave you enough information to kind of borrow our belief that you guys should start trying to tinker and start implementing some of these custom plan of cares to see how it works out in your practice. Now, again, guys, we still got a couple more videos. We're going to dive into some dry needling and, one-off services, some of our niches. We'll go over pricing for some of that stuff, but make sure you guys go check out our selling video, our sales module, so you guys could actually learn how to start selling these custom plan of cares. Okay. See you guys on the next video.